Hi friends, this is Dr. Sachin Kumar, Senior Consultant Pulmonology and Critical Care at Sakra World Hospital. Today I'll be discussing regarding a very common topic, chronic cough. Well, everybody coughs and cough itself is not a problem. Most of the time it is self-limiting because common cold, allergies, these are common causes of cough. So 4-5 days of coughing is well enough. However, few questions are there regarding cough. When to see a doctor or when to seek a medical help when you are coughing. Well, any cough which is beyond 2 weeks or there are associated symptoms like fever or you see blood in the cough or coughing is accompanied by chest pain, breathing discomfort, then maybe it's a sign that something is wrong somewhere. Because cough itself is not a disease, it's a symptom. And it depends on the underlying patient profile also. A smoker who is coughing for more than 2 weeks itself is an indicator to see a medical person. And secondarily, how do we manage a cough and what are the common tests performed? So when the cough is so much that you need to see a medical person, then a thorough detailed history is taken, including the occupational history, including drug intakes, because many of the drugs can also cause coughing, and also a history pertaining to allergies, asthma, chronic bronchitis, history of smoking, and any history of tuberculosis in family members or in the past are relevant histories. Secondarily, after a thorough physical examination to look for specific signs and some common tests like chest x-ray, blood investigation, even sputum examination can sometimes be itself sufficient to diagnose your problem. However, in some cases, the tests can include doing a spirometry for a common bronchitis or asthma-like conditions, and also a doctor might advise to go for CT scan or an endoscopic examination of your airways like bronchoscopy. However, these tests are to be done only in select cases where the suspicion of something wrong is there in your windpipes, and out of 100, almost 90-95 will require only some basic tests. Then how to manage your cough on long-term basis? Well, the answer to this is to manage your basic cause of cough. So as I highlighted, cough itself is not a disease, it's a symptom. So most important in cases of chronic cough is to tailor-made solution for your original problem which is causing cough. So a patient with asthma, COPD should consult his doctor to take his regular medications, and also some vaccinations are there like flu and influenza vaccines and pneumococcal vaccine which can be taken to prevent garden varieties of infections which are very common causes of cough in patients who are already having comorbid conditions like diabetes, kidney disease, heart disease and respiratory diseases. Then finally, cough itself is not a stigma because after COVID many times it was embarrassment in public to cough. So we have to seek an active advice when you are coughing, and if you are coughing for long, then it's a time to see a doctor and seek a medical help. Thank you.